feeling it only slightly, until you reach up until the T4 level, and they'll suddenly realize that it's a pinprick, and that's where they actually feel it. That's called the sensory level. It's a sign of a spinal cord lesion. So now you've demonstrated how to do pinprick and how to use this in order to localize several of important lesions. So moving on to vibration. So one needs a tuning fork. You want the frequency to be 128. You want to have those little nice bells. Without them, it would be more of a laboratory tuning fork. And what you want to do is you want to compare what you're sensing to what the patient is sensing, meaning I do this and I feel the tuning fork, and I can compare myself with Yusuf. حاسس بvibration. قولي له لما تروح. So if he tells me that he is not feeling it way before I sense that it's gone, and now we're basically the same, which means I'm young. So if he tells me that it's gone way before I feel it gone, it means that he has a problem. One other way to do it is to actually count the seconds. You look at your watch and you count the seconds. Pitfalls. So you want to test it in the lower extremities by putting it at the bony landmarks. So you want to test it here, and you can count how many seconds, and then you can move to the bones of the feet, and then the shins of the tibia if the person is not feeling. So do not put it on soft tissue, it's less conductive. That's the classical teaching anyways. So in the hands, you notice I also use the bony landmarks right there. So these are important pitfalls. Another pitfall is that in the elderly and people who are over 60, people will very commonly have a reduced sense of vibration in the lower extremities. It's important to remember that peripheral neuropathy sometimes spares specific modalities, so one wants to test all modalities. So finally, one wants to test for joint position. So the way to do it is to teach the patient. Tell him you hold the big toe from the sides, not like this, because this way you would provide him with pressure information. You want to test only joint position, and you tell him يوسف كده فوق كده تحت. أنا حرك إصبعك أنت هم العين كده فوق ولا تحت؟
تحت.
الحين.
تحت.
الحين.
فوق.
الحين.
فوق.
الحين.
هاد.
الحين.
تحت.
الحين.
تحت.
You notice that you have to do it multiple times because each time there's a 50% chance that he would not do it. If people have difficulty at the big toe, you can do it at the ankle. You sort of hold the ankle from the side and do it, up and down just like that randomly. You can also do it here in the upper extremity. So you control the distal phalanx and get on the line. كده.
تحت.
كده.
فوق.
كده.
Neutral. تحت. تحت. تحت.
That's good. And that's how you do joint position. The last modality we did not demonstrate is temperature. So people often use the tuning fork. يوسف هذه كيف والله؟
باردة.
باردة صح؟ دحين هنا كيف؟
باردة.
وهنا؟
باردة.
Okay. هنا في برد؟
لا ما في فرق باردة.
ولا هنا؟
لا ما في.
وهنا؟
باردة.
وهنا؟
باردة.
That's an easy way to test temperature. As you are noticing, the sensory exam depends on the patient's perception and your judgment, and you really have to tailor which modalities are more more valid in which patient and what you want to compare. So once again, you want to compare distally with proximally in cases of peripheral polyneuropathy. You want to focus on dermatomes in cases of nerve root lesions. You want to compare different nerves in cases of where you're suspecting a nerve lesion, and you want to look for a sensory level in cases of spinal cord lesions. The very last thing you want to do is you want to do what's called the Romberg sign. You should focus on that. So people with problems with their proprioception and joint position sense will have difficulty maintaining their stance when you have them close their eyes. غمض عينك. حط ايدينك قدامك زي كده. And that's called the Romberg sign. He is not more ataxic when he closes his eyes. And you try to tip him over a little bit and you see that he maintains his stance with no problems. If a person tips over or is unable to keep his stance when they close their eyes, that's called the positive Romberg sign. That's a sign of sensory ataxia or joint position sense proprioceptive deficits. And this concludes our sensory examination, and we can move on to the next part.